We just shared a story of a triad woman battling breast cancer for a second time. In each of her cases, early detection was key. As part of To Your Wellbeing, radiologist Dr. David Williams is here to talk about early detection and why it's really so crucial.
And Dr. Williams, let's first talk about types of screenings. What are the options available and why are they so important?
Sure, you're right. It is really important to screen women for breast cancer. About 1 in 8 women will get breast cancer during their lifetime, so it's a common problem. And screening programs can significantly reduce the number of women that die from breast cancer. So the primary way to screen people for breast cancer is with a mammogram. So a mammogram is essentially an x-ray of the breast, allows us to look for masses or other findings that might indicate that there's breast cancer. And a screening mammogram is a mammogram done in a woman without any symptoms. The whole point is to find a breast cancer before there's a mass, before there's a symptom, when it's small and before it's spread. And studies show that when we do this, that we can reduce the number of women dying from breast cancer by 30 to 40%. So that's important.
Right.
It's also important to know there are 2D and 3D mammograms. That causes some confusion in people. Really, both are effective. If you have both available to you, I'd recommend a 3D mammogram. It does a little better job, but really any mammogram is better than no mammogram. The second thing a lot of women will have is a clinical breast exam, and that's essentially when their physician feels their breast looking for a breast cancer. I certainly meet women that find breast cancer that way, or physicians that do. It's an important part of the screening process. But again, we would rather find it with a mammogram before it can be felt.
And as we're talking about this, let us know, you at home, what you use in the Vote Now section of our app. We'll look at the results here in just a couple of minutes.
And we were just talking about how important mammograms are. When do women need to start getting those, and how does actually your family history change that?
So I'm a radiologist, so I follow the recommendations from the American College of Radiology Society of Breast Imaging, and they recommend starting a mammogram at the age of 40 and doing it once a year for the majority of women. So that's for any woman that is not high risk. A woman that is considered high risk for breast cancer, so perhaps a strong family history, many of those women need to start earlier, and it really depends on the situation, so they should work with their physicians about figuring out when to start. So I would say rule of thumb, most women, 40 once a year. And high-risk women also often need to start earlier, but they should also consider a breast MRI once a year in addition to mammography.
You say another factor in early detection is a woman's type of breast tissue, dense breast, for example. Why do you say a mammogram alone might not be enough for detection?
So in women, regardless of their density, mammography is still the main study that's recommended. But to understand breast density, you need to know the breast is made of fat and glandular tissue. Those are the normal tissues in the breast. And a breast cancer and glandular tissue are the same color on a mammogram. So if a woman has dense breasts, which means more than 50% of her breast is glandular tissue, then it's easier to hide a breast cancer in there. We'll still find most of them with a mammogram, and it's still important that they get a mammogram. But many women say, well, what should I do? If mammogram's not as good for me, what should I do? And we've struggled with this as a department and as a group, but we're now starting to offer something called abbreviated breast MRI. And the point is, breast MRIs in women with dense breasts will find cancers that we can't find with a mammogram. Abbreviated means we're doing it more quickly, it still provides most of the benefits, and it'll be far less expensive than a standard MRI.
And let's quickly take a look at those results. How do you screen for breast cancer? The majority, 82%, are saying annual mammograms. In second place, self-exams at only 18%.
Well, Dr. David Williams, thank you so much for coming in today. We appreciate it.
Hey, it was great to meet you.
And if you've still got some more questions about breast cancer, maybe some concerns even, you can actually join us for a live chat this Wednesday at 4 p.m. called Breast Cancer Journey from Early Detection to Survivorship. It is on our Facebook page.
And if you need more information about breast cancer and screenings, we've linked you to Cohen Health's resources on our website, WFNYnews2.com.